What's up guys, Dr. Aaron Macron here with Revival Performance Physical Therapy, and today I'm going to show you guys heel slides or supine hook line heel slides. And basically what this is doing is just bending your knee and straightening your knee. So after any sort of injury to your knee, if it's swollen, if you've been in a cast, you've been in a brace, there's all that swelling after a knee replacement especially, this is a great exercise to start with just to get that knee moving. Shouldn't hurt, maybe a little tension, a little pressure, a little stretching. That's great. We want to push into that a little bit, but as long as it's not too much pain, maybe a 2 or 3 out of 10 pain is okay. As long as it goes away afterwards, you're probably fine. If it's really aching afterwards, then you might have gone a little bit too hard and don't go that hard next time. So what you're gonna do, laying on your back, called supine, bend your knees or whatever's comfortable here. We'll do it with this left side. So in this position, you're just straightening out your leg as far as you can. You can go slower than this if need to. And you're trying to squeeze that quad, these muscles here, to try to flatten out the under the knee. So you're trying to get the underside of the knee to touch the ground here. So if you're tight, say you're stuck there and you can't go any farther, that's okay. Still try to straighten that quad out or squeeze these muscles here to try to straighten it out here. Doesn't matter too much what you're doing with your toe. If you want a little bit more of a stretch in your quad or in your calf, you can pull your toe back. But if you don't want that, that's fine. You can just keep your toes pointed forward. And then from this position, you hold that for a couple seconds, and then you slowly just bring this side back up, bring it as far as you can. I'll go further than you probably can if I'm giving you this. You're probably a little stiff. So say I'm stiff here and that's all I can go. Try to use these hamstrings and pull into that stretch of your knee. If you're feeling that tension in your knee, that's okay. Again, as long as it's not too painful and it's just a pull and a stretch, that's okay to push into it a little bit. Just don't go to where it really, really hurts. So you shouldn't be gritting your teeth, just kind of engaging those muscles in your hamstrings, trying to bend that knee as much as you can. Hold that for 2 or 3 seconds, and then slowly slide it back out and doing the same thing. If you want, as you see, it's kind of grippy on here, so it works better if you're on something that's a little easier to slide. So what a lot of people will do is they'll put a pillowcase on their bed, or if they got silk sheets, fancy you can do that and just put them on the silk sheets, letting the legs slide a little bit easier. But that makes it just a little bit easier so you're not just gripping the floor or whatever you're using there. So do the prescribed amount, kind of do that multiple times a day so that you can really loosen up that knee and kind of get it moving again. And like and subscribe for more videos like this, and comment down below if you want any specific videos you want me to go over.